So excited to be here. That startled me. I am Vanessa Adams. I am the program coordinator for Kids Mental Health Pierce County. A little bit about me. I use she, her pronouns. I am a mom and a little bit of grace today because I was supposed to be in my silent zen to chat with you, and my kiddo school district closed today. So they're around. So if you hear them, they're home. Um, a mom, and I'm a former emergency department social worker. For Mary Bridge Children's Hospital for several years, followed by the long-term behavioral health social worker for 1 year, which is really how I met folks from PAVE and became involved with learning a whole lot more about, as Laura described, the intersect of young folks with autism and mental health and kind of how the worlds collide, working with a couple folks that lived at Mary Bridge Hospital. And really had the opportunity to facilitate multidisciplinary team meetings in partnership with Kids Mental Health Pierce County. And then I transitioned into the program coordinator role for Kids Mental Health Pierce County. And in my role for Kids Mental Health Pierce County, I've had the opportunity to work with so many folks, and Laura described our organization, but really the organization is all of our community together. So a little bit about how Kids Mental Health Pierce County started is really just recognizing that we needed to do better. We needed to have a coordinated response, and that prevention is the most important. And we had really tipped to a crisis heavy model because so many young folks were in crisis. But how could we work together to support our young folks, understanding that crisis comes in many different forms and looks different for different families, and families get to decide what that kind of looks like rather than having a box. Really seeing that no one organization, entity, or human can support the needs of our young folks that are really struggling. And so Kids Mental Health Pierce County initially started the event that propelled Mary Bridge Foundation to fund the first year of developing this coalition and kind of standing up community partners and hosting the summit to develop this. Was there was a young man that was not from Pierce County. He was a young man with autism spectrum disorder, some intellectual disabilities, and mental health challenges that wound up being placed in a home in Pierce County. And he was placed in a home in Pierce County that could not no longer maintain him and wound up at Mary Bridge Emergency Department. And we described this at the time as a sentinel event, something that had never happened, never been heard of. We had never seen that in Washington State. Our hospitals met, we came together, we did not really know what to do. He really struggled in that setting because nobody should live in an emergency department. And he spent 6 weeks, multiple stash injuries, hundreds of thousands of unreimbursed dollars, significant impact on him and folks around him. Now we've seen that happen additional times, and that has changed, but really understanding that I don't understand some of the systems. I've never worked in various systems, and other folks had never worked in the hospital. And how can we merge those systems together to become a unified response to support the needs of our kids and families? So that was really exciting to see the impact of how many people were willing. It's a coalition of the willing. So really understanding that there are so many factors that shape the lives of young people, the mental health of young people, and the wellness of young people. And so this is really important to me as a human, as a social worker, as a mom, that it's not just them, right? Oftentimes people look at this kid as a problem. This is the problem kid. This is where we see it's really so little of the component of the folks that people describe, right? It's I loved the description that Peter described as, and so many other things, right? We are so many other things than just a mom or just this or just that or just, I love that because it's so true about all of us. And in addition to that, it's also, we have so many family dynamics, and our communities impact us differently, and the environment and the world around us has really been hard in the last few years, as we've all experienced. So all of these things kind of go into what it takes to support the mental health of the young folks in our communities. So understanding that it's a whole society effort to address these needs is really important for Kids Mental Health Pierce County. So who we are is a coalition of folks, a coalition of the willing folks that want to be involved and are interested in supporting youth and families in our community. Looking at how do we develop a response that's coordinated, that's effective, that's functional, at the right time, as close to home as possible, the best place for the best outcomes. We know that sometimes that isn't possible, but really looking at how do we focus on that, looking at systemic barriers, looking at creating a continuum that makes sense, starting at birth and going through young adulthood really is our focus, but it should continue on for life. And we are working together. This is a picture of one of the rooms of kind of not the first, but the first core group of folks that were really invested in having these conversations. And this was back in 2018, and it's just continued to grow and develop as more folks are invested or desire, want to learn. And so I'm always open to hearing and wanting to learn from you all, to partner, because the more of us that are interconnected, and understand the different needs of our young people, the better we can function. So here's a little bit, some of our cross-system partners. We have a lot of different people from big organizations, small organizations, the government, law enforcement, schools. And so we have a steering committee comprised of various members of the community, and then implementation teams that anyone and everyone can participate in, really talking about the priority actions for our community, relooking at those every 3 years, to discuss what has shifted and what has changed. So for 2023 and 2024, those priority actions are strengthening our crisis response. And so that really looks at what are we doing for different populations of people, right? We've heard challenges from different groups of parents or different groups of young people, that the response looks really different in different communities, different populations, different diagnoses, different, et cetera. So really looking at how do we come up with solutions that support those. The second one is access, wellness, and care coordination. So as a provider for many years in the emergency department, as a provider in the community, as a parent of someone with mental health challenges, I know that navigating these systems is so challenging. I do this for a job, a career, and I'm passionate about it. And sometimes I'm like, I have no idea. So really understanding that if I have no idea, a lot of other people have no idea. So how do we come together to get ideas? How do we build our knowledge, build our toolbox, and have solutions together as a community? So having people at the table from all over various organizations has really been helpful for learning and supporting. And so these are just a handful of the big ones, but there are so many, too many to even possibly name. So my favorite part of Kids Mental Health Pierce County, and how I described that I transitioned into this role, is because of the community multidisciplinary team. So these community multidisciplinary team meetings can be referred by anyone. I'll get into that a little bit, or show you how you're able to do that, or anyone's able to do that. But these are really community-based and family-focused. So the referrals come in to me, my team, but primarily myself, and they can come from a parent, from a young person in distress, from a community stakeholder, a hospital, an organization, a therapist. We get them, we have conversations, we really look at what are you asking, what are you looking for, what do you need from the community? And sometimes they don't necessarily totally know, but they can give some background information. And then the multidisciplinary team meeting can talk about outpatient service navigation, behavioral management strategies, various components. We get them from the hospital and they need support with discharge planning, or conversations around who else needs to be involved in the conversation. And some of my favorite components of this are just hearing the community come together. That I have seen young people. One of my most impactful multidisciplinary team meetings was this young person that, in the matter of about a month, cycled through different systems, came into the Marybridge Emergency Department with law enforcement, so was immediately involved in 2 systems, came back to the emergency department after an escalation in the home, and then was involved in juvenile justice because the law enforcement interaction resulted in a criminal charge. Family were experiencing challenges and unable to interact in a way that they were able to take them. And then Department of Children, Youth, and Families became involved. Following that, it was just this ongoing cycle. There's so many folks involved, and we were kind of pointing the finger back and forth with what do we do, who does what, how do we support this young person. So when we convened a multidisciplinary team meeting, they're very different and very creative in the way that who attends is the identified support systems, partners from various organizations. And one of the partners on this team was a school staff, an ancillary school staff, not a teacher, a counselor, a principal, but someone that this young person had connected with. And this was early into the pandemic as things were closed. This young person had no history of interaction with law enforcement or significant mental or behavioral health challenges, so was getting involved in services. But this school staff identified that this person had needs to be in person, to be connected in a different way, to be involved interpersonally in a way that was impacting them so severely that they engaged in all of these different systems. And the school worked on a plan and to be able to get this kid out into school 2 days a week before that was even starting to happen. And we never saw this young person in the emergency department again. We never, as a part of this multidisciplinary team meeting, was able to work with some team members in the school ongoing. And the school update was so positive that this person was able to re-engage in education, was able to maintain their education. And we could never have done that from the hospital, right? An intervention from me as a social worker couldn't have been like, you must do this, or from law enforcement to say, this is what's going to be helpful for this kiddo. But someone that knew him and someone that could identify and was his trusted adult was able to come to the table and advocate in a way that was meaningful. And I have, at this point, hundreds of different examples of this, of parents being connected to a support they didn't know existed, or parents being connected to a different parent that they just needed to talk to someone that has experienced something similar and have that support through, our partners through different parent advocacy groups that attend and participate and connect. So there have just been so many of these meetings that the definition of them or them on paper doesn't really even come close to touching how impactful that they are to the people that attend them, to the participants that support them. And these meetings can happen anytime. Mostly they're virtual, but we have had creative options to do them in person for various reasons. And so really these are available to any of you, any of your community partners, anyone. They can submit referrals through our website. And so it's really a straightforward referral on Kids Mental Health Pierce County website. And so just put in the information. And so typically I will respond within 3 days is my goal to the referent. If it's an emergent referral and needs to be done in like 24 hours or to get out of a discharge from a hospital or discharge from a mental health facility or from detention, then we often try to facilitate those within 24 to 48 hours. So if I have an email as well, that they're emergent, and we try to plan for those to happen in a more urgent manner. And there have been times, a holiday weekend this last year, where I sent out an invitation on a Wednesday, and on the Friday of that holiday weekend, which we know how some of those work in organizations, lots of people don't work those Fridays or they're busy or different things. And there were 32 community partners that attended that holiday weekend multidisciplinary team meeting in 2 days and came up with a plan for that family to have support through the weekend, and then them to be connected with additional services on the following week, and an ongoing support plan for this mom. We've remained connected and through some follow-up things. And she has said, I just really didn't understand that this many people cared, that there are this many people in our community that cared about my child and my struggle. And I can identify with that. I think a lot of us can identify with just feeling support from our community is incredibly impactful. So that has been such a fun and exciting thing that is able to support these families. So I kind of said a little bit that this is a coalition of the willing. So these are volunteers in our community that come to these meetings, stakeholders from different organizations and schools, school districts, behavioral health organizations, the hospital. We have a couple of psychologists, psychiatrists that attend these meetings when appropriate, various DDA representatives, DCYF from the corporate office or the state office or different offices, our crisis partners. We have specialists in all different fields. So really, I try to be intentional with who's invited to different meetings, and I'm always inviting folks. So if you have information or excuse me, if information or can provide support to a population or specific folks, and I'm always looking for folks that are willing to support, come together. And so I try to invite folks in an intentional way, right? Like, so it makes sense, what makes sense to the specific person. So I'm not, I might not be inviting juvenile justice or our partners through Pierce County Juvenile Court if it doesn't make sense and they've never been involved or aren't involved. I'm not going to invite them unnecessarily, right? Like they're specific to the youth and families and their needs. So there's a various network, and we've seen all sorts of people, including the families identified support. I think that's one of the most important things, is really reaching out and understanding and having conversations and building relationship to know what's important for this parent, this caregiver, this foster parent, this young person. Sometimes the youth attend and sometimes they don't attend, but really building this to support the kids and families and meet them where they're at. So these meetings typically go for an hour. The family provides some history, context, a little bit of background. The team asks some clarifying questions, but we really look at moving into recommendations and how to support and making these useful and supportive for the family as quickly as possible. So I or one of my team members documents everything so the family doesn't have to be like writing down phone numbers, seeing whose email is what and what happens, because as recommendations pop up, take the notes and make sure to really gather the information in a way that's helpful for the families. Like I said, it's confusing and challenging for me, so it might be for others too. So really helping the family navigate some of these system things in a way that's in a way that's functional. So the MDT can't make referrals, it can't guarantee services, and we make sure to say that so that folks that are participating and making recommendations aren't like held accountable for something that doesn't happen or work out. But we haven't had that a problem in our team at all. But for some organizations, that's important for them to be able to participate. So information sharing is important for some components. So there are specific youth that might be in an emergency department. So if you're working with a young person that is in a hospital or in a crisis setting, then we're able to share information without an ROI in the same way as some of the others. But so for our young people, if you make a referral, a parent needs to sign an ROI for 12-year-olds and under, and a young person for 13 and older, with some different scenarios that might happen. But that looks different for the hospital, but really having them understanding that we're coming together to support them, that we're looking at finding resources and helping. I like to talk to the young people if the young people are willing or able or capable of doing that, but to really hear from them, hear what they identify as a challenge, identify as supportive, and hear from the parents as well, because there have been times where they feel really different. Their ideas of what's helpful are totally different. And so when we can come up with recommendations for both, for a parent that's having some sort of need and a young person that's having some sort of need, there have been a few of my young people that have come back. I always give them my information to follow up or ask questions. And there are two that have participated at Behavior Bridges in some of the groups, and one of them being one of the gaming groups. And they said, I didn't care about any of those horrible counselors that did the horrible, boring things. And when we had this conversation, and I just chuckled because I'm like, I absolutely understand that. But what you don't understand is you are getting support in a meaningful way in a different space. And we kind of got you there, kind of helped get you there, gave you the resources, told you it's a little different. Just try it one time. And the one time has turned into many times. And so it's really the opportunity to hear from both and understand the needs from both ends and support in different meaningful ways has been just so incredible for me. So this is a QR code for the website, and has, as Laura said, there are resources for all sorts of things on the website. We're always adding resources, changing things, adjusting information. So if you see something, know something, have something, we're always happy to post it. Really looking at supporting a community calendar as well, adding things so that families can go to one place, one spot to kind of get additional information, to learn things, or at least be guided in the direction that they're going. So I'm happy to provide information through the website. If you have an event, if you have something cool that's going on, I share out through the newsletter, the monthly newsletter that goes out to about 2,000 people in Pierce County. And then our website is visited. I think the average for 2023 was about 9,000 times a month. So there is a lot of opportunity for sharing information and connecting with the community as well. So those are two additional components of Kids Mental Health Pierce County. And then support and community education is another one. So if you have information or education you want to share with the community, Laura has shared through a webinar forum about the different programs through Behavior Bridges. Andy Song from Kids and Family Counseling has shared various components through Kids Mental Health Pierce County as well. And I know other partners who might be affiliated or associated have too. And so I think the more that we can share with our community, the more we can get resources out there, because I think that one of the things that happens is we definitely talk about gaps, and I can identify that there are gaps, but there also are incredible things going on in our community. I am so fortunate to learn all the time about new ones or different ones. They've been around for a long time sometimes, and I'm like, this is new to me. So if it's new to me, it might be new to a family member that could utilize it or benefit from it. So I think the more that we can share the positives, the good things going on, the supportive ways that we can connect, the better we can support the young people in our community. So the website and the newsletters are a way that we're really working on doing that. I know that some of you are in different regions. I'm going to allow for ask for questions, but I did want to highlight that the Kids Mental Health Pierce County model of the community-based meetings, and the education and the kind of hub of support is expanding statewide. So at this time, Kids Mental Health Pierce County is expanded to Kids Mental Health Washington. And on the Kids Mental Health Washington side, you can visit that website, and I'll put those in the chat shortly as well. But the Kids Mental Health Pierce County, or the Kids Mental Health Washington site, excuse me, has a map that shows your region, and they're in different phases of expansion. So we have three systems that are live. We have three BHOs that have already expanded. So Greater Columbia, Southwest, KidSAP, they have their own teams. And so they facilitate multidisciplinary team meetings. They have a website, they have their own component, and really understanding that our communities are going to look different. You know, Southwest is very different than Pierce County. Pierce County's BHO is just Pierce County, and the population is different, and the regions are different, and different regions of Pierce County are different. So understanding that the goal is to meet the needs and identify what is needed in each community is the goal of Kids Mental Health Washington. So at the end of 2024, it will be fully statewide, which is absolutely so exciting. So the last two regions for the end of 2024 will be King and the North of King region. Those are going to be the last two. But other than that, every other region has started the expansion or been expanded and has a fully set up team. So that is so exciting. And for me, I just always point back to Pierce County has done just such an incredible job in building community. And I can't stress that enough as I've been in this role. It's relationships, it's understanding each other, it's being there and building those collaborations and connections and partnerships that's been so important and so effective. I think that is really what it boils down to, is building a community takes relationships. And the more we can be in relationship with one another and understand how we can support, it might be one little thing that someone comes to the table to support, and that little thing could be a massive thing for a family. So I just want to encourage you to come, be curious, let me know, chat with me. I'm happy to share. I'm happy to learn. And that's really the spirit of Kids Mental Health Pierce County. I know that sounds like a technical term, and I can't type that in a report to Healthcare Authority, but it really boils down to that these coalitions participating and knowing one another is what has been most effective in Pierce County and why it is expanding statewide. So I am happy to answer any questions that you have. I have my contact information, and I'm really just so grateful for you all and all the work that you're doing. There have been folks from PAVE that were a part of Kids Mental Health Pierce County before I was a part of Kids Mental Health Pierce County. So it's just really exciting. I'm so grateful for the work that you all do and that I get to be a part of it now.
Thank you so much, Vanessa. I really appreciate you coming and speaking. Any questions for Vanessa?